Good evening. Welcome to my first Facebook Live talk here from home during this time with the coronavirus. I'm on kind of like lockdown due to some health issues, but I just wanted to share with you that we are having a good time at LowTE Florida. Everything is working well. We are keeping our social distance and we're only treating the patients that absolutely need it. And the girls are wearing masks and gloves and making sure everybody that comes in has been screened. So anyway, let's go on to our talk tonight. It's titled, Are You Balanced? And what we're talking about is your hormones. And your hormones affect so many different parts of your body that it's amazing because we tend to think of hormones as like sex hormones, but they really affect your joints, your brain, your mood, hot flashes, night sweats, the whole bit. So we'll go into that. I'll have plenty of time for questions, and if you want to send some in during the talk, I'd be happy to answer them. But we have plenty of time, and then if there are too many questions, we can always answer them at the end of the day. We'll do another little post. So why I became a nurse, number one, is my great aunt Edna was a nurse back in the 1920s. She grew up in Chicago, graduated from nursing school, and her girlfriend hopped into a Model T Ford and drove to California to become nurses to the stars. So I grew up on a farm in California, and Aunt Edna used to come and visit us in the summertime, and she would tell me all these glamorous stories about how great it was to be a nurse. So ever since I was little, I always knew this was my calling and this is what I was going to do, and I've never looked back. I've always been very happy with my choices going into nursing. So one of the stories she told me about was Clark Gable, that she ended up taking care of him in his home during his later years. And that just made me want to strive for greatness with my nursing career. And through my nursing career, I've had the opportunity to actually work with Suzanne Summers, met her, worked with her on a couple different projects, ran into Dr. Oz, tried to convince him he needed me on his show. Still waiting for that phone call. So I've had my moments of greatness with my nursing career. Plus, I have a bunch of wonderful patients here in South Florida and from all over the world, actually, that fly in to see me. So it's very fun what we do. I love my practice because, number one, I see a lot of people that come in that don't really feel well. They don't feel as good as they did maybe 10, 15 years ago. And I can, number one, give them hope that they will feel better. And then number two, make it actually happen. So I've got a lot of happy campers. A lot of people are saying that we've really changed their lives, changed their relationships, that they like themselves better, their partner likes them better, and they just are enjoying life better once their hormones are balanced. So I attained my education here in Florida. I started off at Broward Community College, transferred over to Miami-Dade Community College once I procured a job working for the transplant team at University of Miami. I ended up delivering kidneys all throughout the country on the transplant team. So that's how I worked my way through school. So I transferred to Miami-Dade for that, and then finally finished up my bachelor's, my master's, and my nurse practitioners at Florida International University here in South Florida. So I've been prescribing hormones for over 28 years. I know I look like a teenager. No, I'm teasing. But I have a long history with hormones and absolutely have become passionate about prescribing hormones for my patients that are going through menopausal symptoms and changes with life that just are very uncomfortable and not much fun. So I was getting such good results back in years ago when I first started out. I started working straight out of school with a physician. And he was OBGYN, and I felt like I needed to learn more. And so I was sitting at his desk and just reading his charts, learning his treatment programs, protocols, and the whole bit. And I noticed that for all the menopausal patients, he was writing psych referral, psych referral, psych referral. So finally, I went to him with this big stack of charts, and I told him, look, I said, all these ladies can't be crazy. He said, oh, yes, they are. He says, they're sweating, they're screaming, they're crying, their relationships are a mess. They need to get their lives together. They need to go see a psychiatrist. I said, can I have those patients? And he's like, God bless you. You go forward. You take them. I'll go deliver babies. Perfect. So I really got into fine-tuning my prescribing skills then, but this is back in the day of the synthetic hormones. But I knew how wonderful it was to help women feel better during this time. So in 2002, there was a huge study of lots and lots of women, that the Women's Health Initiative, and it basically blew our synthetic hormones out of the water. It showed that the synthetic hormones had an increased risk of blood clots, heart attack, stroke, breast cancer, and even Alzheimer's. So we knew we needed to do something different. So I had heard about bioidentical hormones, but I wanted to be the best. So I needed to study it and learn from the people that knew this the best. And what we've learned over time is that synthetic hormones and bioidentical hormones are kind of like apples and oranges, very, very different. The synthetic hormones, like I said, have all those potential side effects. We're finding with the bioidentical that was a polar opposite. It was actually supportive to your life as you age, that it was healthier to age with hormones versus without. And so what we've noticed is there's no increased risk for the blood clots and strokes and heart attack. It's actually supportive for the heart, for the breast, the bones, relationships. We're going to go through all that in just a minute. When I decided to study this, I started my research, and I found 3 of the nation's greats, and decided I wanted to study under them because I wanted to be the best I could be. I didn't want to hurt anybody. I wanted to prescribe the right medication at the right dose, the best delivery system to get the best result. So I packed up and went to Salt Lake City and studied under Dr. Neil Rousier, and he's brilliant, internationally renowned, knows the research inside and out. He went over research study after research study, and what he was bringing home to me was not only are there feel-good effects of the hormones, but how much healthier it is to age with the hormones versus without. So I came back home, I was all excited, but then I realized he didn't teach me how to dose, and that's critical to get the right dose to get your patient feeling their best. So I went and I studied under another doctor in Orlando, then another one in Naples, and I still was frustrated. I was talking with a colleague of mine, a doctor in Utah, and I was just ready to throw it in. I'm like, I can't do this because I need to know I'm doing it the right way. Well, he says, humor me. He says, go to Texas. You need to study under Dr. Gary Donovitz. So what do I have to lose? I pack up, I go to Texas, and sure enough, he brings it home. He gave me the confidence that what I was doing was good. He filled in my gaps of knowledge, and then he taught me how to dose. And we dose personalized just for your body. So your dose will be different than mine, different from the girls in the office. Everybody has a different dose based on their lab work combined with their medical history, and then their age, their weight, hormone levels, thyroid levels, because a sluggish thyroid can mimic low hormones and vice versa. We don't want to fix one and not the other. And then we put in your vitamin D because that's critical for your bones, teeth, mood, and prevention of cancer. And then also B12. So we want to know your energy vitamins. So with all that, it goes into a computerized program, and we get an exact dosing of exactly what you need. How much estradiol, how much progesterone, how much testosterone, thyroid, if it's sluggish and needs correction, we have that. Then supplement recommendations, because we found that if we optimize the nutrients at the same time as a thyroid, we get an even better result with the hormones. So what are hormones? Hormones are chemicals that are produced by our glands, our ovaries, testes for men, even in our little adrenals and such. And what the hormones do is they flow throughout the body. They fit into the receptor sites on all your different organs in your body. And they work like messengers in a lock and key fashion. And so what are bioidentical hormones? Bio stands for biology, so it's plant-based. What we use is derived from wild yams, very safe. And identical, of course, means the chemical molecule in our product is exactly the same as what our ovaries and testes for boys used to produce before. And the hormones that produced by our ovaries and testes are happy hormones. They help us feel good as well as help our bodies function better. So how do you feel? What brought you to this talk tonight? Do you feel balanced, or you think maybe things could be a little bit better? We can help you with that. Some of the symptoms women and men may notice as their hormones start to decline, and women start to decline in their hormones, it can be as early as your late 20s, and for men in their early 30s. So this can be going on, and it can be a quick drop or it can be a slow drop. I've seen young men in my practice that are like 35 and their testosterone is way lower than their father that I treat that's in the practice as well. So it's not necessarily correlating with the age, but just their own body and their experiences and their exposures and stuff like that. Hi, Tammy. How you doing? I see people popping on here. This is good fun. So some of the things that both men and women may notice, and it's the number one reason that brings people into my practice, is the extreme fatigue, just feeling so tired. You wake up feeling tired, you're tired during the day, nodding off at your computer, maybe even when you get home. And this was true for me because energy was a big game changer with me once I optimized my hormones. Is that when I got home from work, I knew I was doing a good job. I was working, I was seeing my patients, I was dealing with a lot of patients that were dealing with cancer. And so that's emotionally draining for me. So I was giving myself excuses as to why I was so tired at night. And it got to the point that my goal was to feed and walk my dogs, put my jammies on, pour a mug of wine, and hit the couch. Everybody's heard that story that knows me. But anyway, after I got my pellet, about a month later, I realized I was out cleaning the garage, painting the baseboards. I wanted to go out. Life was just getting a lot better. And it was because my mood was coming up and my energy was coming up. So people may notice that extreme fatigue, mood swings, like I said, maybe a little snappy, maybe just feeling down and not knowing why. I always thought that anxiety would decrease as we got older, but I'm seeing with my patients that it increases. So we want to get that taken care of. Tension, irritability, lack of sleep. Who wakes up at 4 a.m? Anybody out there? And then you can't get back to sleep. And that's no fun because it's hard to have a good day if you don't have a good night's sleep. Brain fog. A lot of people talk about how once their hormones are optimized, that they feel this like brain fog lift and that things are firing a little bit quicker. Your focus becomes a little bit better. Hot flashes, night sweats for both men and women. Men can have night sweats as well. They can wake up with that wet sheets just like the women. Weight gain for both around the middle, and it doesn't want to leave. And that's very, very frustrating. I hear it from my patients, the new patients coming in every day. They grab their middle and they say, I used to have a flat stomach. What the hell is this? Make it go away. So it's just part of aging, and we can fight it, and we'll work on it. We'll work on it together. But joint pain is another interesting thing because you wouldn't think of hormones affecting your joints. But I do have a lot of patients that say that they notice when their hormones are starting to decline, when they're coming due for their next pellet, that they notice their joint pain return. So that's one of the signals that they get. Migraines, headaches, a lot of times those are taken care of with the hormones. And mild urinary incontinence. I had this one patient, and close to 80 years old, that said that she knew when her pellet was due because she'd noticed that she had her mild urinary incontinence return. So it can help keep those tissues down there healthier and plumper and more youthful and help support the bladder. Then the other thing is a decreased sex drive. And I hear it from women, and I do hear it from men too. I didn't think that was possible, but it is. They just lose interest and motivation. You just don't feel like yourself. Sexual relations tend to become the last thing on your list of things to do for the day. So what we know is that testosterone really helps with that. And I've got many, many people very happy with it. Estrogen for women, it's present in both men and women, large amounts in women, small amounts in men, has over 400 functions in the body. The one we know most about is the hot flashes, but there's emotional, mood swing stuff, helps with your bone density, helps with a lot of different things in your body. I mean, 400 functions, helps with the collagen in your skin. I noticed back when I was first prescribing hormones, my mother and I were sitting in Sea-Watch, and we were having fun pointing out who had the benefit of aging with hormones versus without. And we could tell by their skin on their face. The ladies with that dry, crinkly, thin skin that looks like you can tear it when you touch it, they hadn't had the benefit of estrogen as they were aging. And whatever's going on up here is going on down there. So when you lose the estrogen, as time goes by, you can have dry mucosa, painful intercourse, things become thin and friable, easily tear, and just very uncomfortable. And so bringing the estradiol back into the body helps relieve that. And usually it's a quick fix. So I have several patients that have come in saying that sexual relations were just like so painful. It was like shards of glass or knives stabbing at them. And then like within a week or two, they were calling me saying, oh my gosh, life is so much better. So that's pretty good. And estrogen is really a happy hormone, as is testosterone. So we give out a lot of happy at LowTE Florida. Some of the positive effects of treating with natural testosterone is that increased energy, vitality, and sense of well-being. Just more, you feel more like living. I had this funny thing. There's going to be another article coming out in Lifestyles that I just wrote about a patient that came in, and she says, you won't believe what you did to my husband. It's a miracle. And I'm like, what did I do? And she says, you got him out of the chair, out of the chair. And she said he used to come home and flop in the chair and he didn't want to get up. He didn't want to go out. He didn't want to go to restaurants or movies or anything. And now once he's been pelleted and it's been a month or two, he's all raring to go. And so a lot of times what we find is I'll treat the woman and then she'll bring in her man in a couple of weeks and he'll want to get those pellets so he can keep up with her. So you have an improved feeling of overall well-being. Depression tends to go away. Anxiety lightens. You think clearer, like I said, improved memory. Why did I go in the kitchen? Where are my keys? Your focus is better when you're at work and when you're focusing on a conversation. Testosterone is protective for the prostate and protective for the breast tissue. There's crazy good studies out about how protective it is for the breast tissue, showing that women on testosterone pellet therapy have like 40–50% less incidence of breast cancer. So that's great. I mean, talk about being apples and oranges. That's where we're at. Testosterone actually helps rebuild bone. It lays down bone. So if you have or know somebody that has osteoporosis or osteopenia, they need to be on the testosterone pellet because it actually relays the bone. And I'm not saying this just from reviewing literature. I see it clinically in my practice all the time. With my gynecology practice, I do bone density scans on some women as they're aging every couple of years. So if it shows osteopenia or osteoporosis, once we start treating them, I'll redo it in a year or two and it improves. The numbers on the osteoporosis reports are getting better, and the ones with osteopenia many times come back as normal. If you can age without having that, without having osteoporosis, having those brittle bones that you hit your wrist on the counter and it breaks a bone, I mean, I'm signing up for that. It also helps you rebuild your muscle because you can't build muscle without testosterone. Anybody over 50 working out in the gym, they can lift weights up and down all day. And if they don't have testosterone, they're not going to build muscle. They may be able to maintain muscle. They may be able to tone a little bit, but they're not going to build the guns that we used to be able to swing the weights for 2 weeks and get. So bringing the testosterone, I have women and men that are telling me that they're looking more cut, because they're hard workout people. And a lot of people lean out. It's a leaning out hormone is testosterone. If you picture when a guy's testosterone is its highest, it's when he's in his late teens, early 20s. Those guys are usually long and lean. They've lost their baby fat and they're really looking good. So it also, we have a funny thing with LowTE Florida. I've had a couple patients tell me that their primary care providers are scratching their heads wondering why their cholesterol is coming down. And the only thing different we've done is added the pellets into their system. And we're seeing it actually naturally lower cholesterol. However, if you keep eating those pork rinds, we might have a struggle with that one. Enhanced libido. You tend to think about sex a little bit more. And when you do have relations, it's like the fireworks are brighter. It's just a lot more fun. Things are more reactive, more lubricated. It works better. So the sexual performance for both men and women tends to be better. Better blood flow, everything's better down there. Then another one that I hear time and time again is an improved sleep. And like I said earlier, without a good night's sleep, it's hard to have a good day. So a lot of people, once we optimize their hormones, will say that they feel like they're getting a more delicious, more restful sleep, waking up feeling more like doing exercise, more like making better food choices. And all this adds up to where they're leaning out and living a healthier life. Testosterone, besides providing major symptom relief, like we went over, it protects the bones, as we reviewed. The brain, the studies are showing it's protective for the brain to the point that it actually helps with preventing Alzheimer's. I mean, what wouldn't you do to prevent that? The breast, protective for the breast. The heart, less incidence of cardiac events on people that are optimizing their hormones. Joints, less incidence of osteoporosis and arthritis. And relationships, you're nicer, you get along better, you just feel better. So testosterone, a lot of women don't know that we naturally produce it, but we do in our ovaries. But it can start to leave the building in the late 20s. So that's really not fair, but it is what it is. So a lot of times, it can, like I said, it can be a slow decline or a quick decline. And I've had a young woman came in, she was like about 35, I think. And she's like, I just don't get it. I've got this great husband, this great life, house, job, the whole bit. And I just don't have those chemically feelings for sex, for relations with my husband, and I love him truly. And I said, well, let me just do some blood work. So we did her blood panel. It showed her testosterone was actually so low you couldn't measure it. So I corrected that, had her come back in 6 weeks, and she was like a rock star. She was so happy that she had gotten her mojo back. She felt more sexual, more energetic, more like her old self. And I like to say when we optimize hormones, it's kind of like turning the clock back maybe 10, 15 years, to where you used to feel great when you had your swagger, when things were really rocking. So there's testosterone in both men and women, of course, large amounts in men, lower in women. And then there's men will be losing their testosterone, like 1 to 3% of their total testosterone every year. So it's really kind of not fair because it's a real happy hormone. So if we can give that back, let's do it. There's no harm in it. I worked with Suzanne Summers on a couple different projects, as I mentioned earlier, and she has this one thing, the 7 Dwarves of Menopause: itchy, bitchy, sweaty, sleepy, bloated, forgetful, and psycho. And the psycho one always reminds me of my first job working for that physician who thought all the women in menopause needed to see a psychiatrist. So we can pick on the men for a minute. I don't see any men have logged on, so that's good. Men tend to just kind of fall into the chair, get a little weight around the middle. If their hormones are imbalanced, they can get the man boobs, and they just don't feel like doing anything. They're more content to just sit there with the remote control, a beer, put the dog on the treadmill instead of themselves. But there's hope. We can help them. So a lot of men will find themselves feeling sluggish and tired all the time, gaining the weight, losing muscle, depressed, irritable, lacking in sexual desire. Now, what we have been doing also is treating returning war vets and first responders that have been diagnosed with PTSD. And we've had fabulous results with that. There's a video, I believe it's on my website. It was a qualitative study going over how they were feeling after they had their hormones optimized. And it's very emotional. They really have felt like the pellet system has helped them get out of the house. They feel more like exercising. They're nicer. Their relationships are better. They're able to build muscle. Their sleep is better. I had one that I treat tell me, look, Carolyn, you can't take away the nightmares, but the rest of my sleep is much, much better. And the rest of my life is much, much better. So we're using it in different ways, for different people, for the PTSD, for menopausal symptoms, and for andropause or male menopause. So how do we usually treat this like on our own? We juice up the coffee. We may have a cappuccino, a couple extra cups in the morning to the point you may feel a little bit jittery, but you may want to take diet pills, because this low energy is such a problem. Alcohol, uppers, yeah, let's take some diet pills. That'll jazz you up. And weight loss medications, it's just not good. Then there's the other thing of different diagnoses doctors are giving, such as fibromyalgia and depression and insomnia, erectile dysfunction. And the medications a lot of times have more problems than good. So right now, if you were a female going into your traditional OBGYN's office, what are they going to prescribe for you if you're having hot flashes? Oh, my audience isn't going to tell me today. Okay, number one, they're going to prescribe you an antidepressant. But wait a minute, I wasn't sad. I was just having hot flashes. Nope, you're on an antidepressant. That's going to take care of it. Didn't quite take care of it, but guess what? I got fat. Oh, great. Okay, so now I'm fat and having hot flashes. Okay, well, I got something for that. Let's get you on a diet pill. Yeah, I got some phentermine here for you. Okay, well, that'll jazz you up. That's good. Okay, so you're hot, you're fat, and you're all jazzed up. And guess what? Your blood pressure goes up. Well, I got a pill for that. That's not good. Okay, and then the corker on this, because you're still hot and having hot flashes with high blood pressure and all this stuff, is you get to go on a statin. Isn't that great? And then you get to have leg cramps and all kinds of bad risks with that. So it's really your decision on how you want to age. If you want to age healthier with a bioidentical hormone, plant-based, or do you want to age with a whole prescription, have your medicine cabinet filled with prescription bottles? That's not how I want to age. Because I used to have patients, they haven't really been saying it lately, but they just say, I want to age naturally. And I'm like, okay, let's take an apple, put it on the counter. Let's go back and look at it in 3 months. Is that really how you want to age? Not me. No way. The pellet system that we use is very well studied and has been around for a long time. The first studies we can find are from 1939. I first ran into the pellets in 1979. I was training in surgery in Memphis. We did a hysterectomy on a woman, closed her up, rolled her over, and put the pellets in so that when she woke up, she wouldn't feel so bad. So it's been used here in the United States safely for years, and in 5 different continents. It's not just us. There's a lot of good research from England as well on the pellet system. It is the safest way of getting hormones into your body, and that's one of the reasons I'm keen on it. I've personally tried all the other methods, the shots, the pills, the patches, gels, creams, oils, all that, and I never really felt well until I got the pellet. So for me, that really worked, really worked. So I'm affiliated with BioTE Medical that's based out of Texas, and that's where I did my training with Dr. Donovitz years ago. And with BioTE, we have learned that optimizing the nutrients at the same time as the thyroid, we get a far better result with the hormones. But going back to the hormones, we want to use the right hormone, which is bioidentical. We want to use the right dose, which is personalized just for you. As I said, we have a dosing site where we can actually input your information and print out a plan. So, and then we can discuss it and see where you want to go. And of course, the right delivery system, which I think is the safest, and as literature shows, is the safest way of getting hormones into your body, which is a pellet system. And the pellets are tiny little, there we are, tiny little pellets, so kind of like a grain of rice. It goes under your skin on your backside. And as your blood supply passes by, it picks up the little micro pieces of it and brings it into your system. So over the first 4 to 6 weeks, it gradually builds up, then it holds it steady for 3 to 5 months. So it's really kind of an interesting experience to go through because we get you tuned in right where you should be because we're using your science. But what we do, our usual protocol, and things are different now with the virus, in that usually you will come in for a consultation, and we can do that over the video telemedicine stuff, in the meantime, so we're ready to go when the time comes. But then we need lab work. If you have it from another provider, we can use that if it has everything that we need. And then we have you come in to get your pellets. And then 6 weeks later, we have you come in just for a tiny little blood draw to check in with you. We want to see which symptoms are resolved, which ones we need to touch back on. And at that time, if you need more, we give you more, a little boost at no charge. So, but we need that little marker there to know that our prescribing is spot on. And I've been doing this for over 7.5 years, and pelleted over 8,000 butts, I think. And 95% of the time, the dosing is spot on, meaning we don't have to do anything. Once in a while, we may need to give a little bit more. But the pellet system, the dosing site that we use, tends to err on the conservative side. So we don't have people saying, oh, you gave me way too much, you got to get that thing out of me and the whole thing. Because I hear from people that, I don't want to use the pellet because once it's in, you can't take it out. Well, that's true. You can't take it out, but it's not an evil thing. It's a good feeling. I don't have people wanting it out. But with that, how do we personalize a dose? Like I said, we take your medical history along with your lab results and combine that together. Some of the nutraceuticals that may be recommended for you, because that comes out on the dosing side as well. If your thyroid is sluggish, it'll recommend a thyroid prescription. So we'll call that in for you to get your thyroid optimized at the same time. So it'll tell us how much testosterone, how much estradiol, how much progesterone, how much thyroid. Then if your thyroid needs correction, a lot of times it'll recommend iodine, which is great because it also has selenium and zinc, which are antioxidants. And then also your D, if your D is low, instead of guessing at the vitamin shop, it'll tell you exactly how much to take, probiotics, omega-3s and all that. And we'll talk about that once we get yours done. So some of the benefits about the pellet therapy is it's safe. Hundreds and hundreds of studies, over 80 years experience, clinically effective, steady state of hormones, where with the shots, the pills, any of the other way of bringing the hormones in, you get a great big spike and then it comes down. So you feel great when it spikes up, but then as you come down, you don't feel so well. And so it's a roller coaster. You're going up and down, where this just brings you up and then holds you steady. So it's the best way to increase your bone density, to protect your breast, help with your brain, and also help with your relationships. So what do you need? You need a hormone expert. That's what you got. You got me. I'm more experienced. I pelleted more people in Florida than anybody else. Been ranking #1 for years. You've got competent, caring professionals, and I've got a great staff, and we have affordable pricing. A lot of times, if you just go to Boca to another provider, they'll charge double, and that's fun. So what you need to get started, you can always call the office. You can speak with Nicole. A uh, uh, online little consultation. I just read a little note here. Somebody popped up here that says pellets have been a game changer for me. And so I just love seeing that. So I was a little bit distracted. But you can talk with Nicole. And since you've been here listening to this, even if you're listening to a recording, you qualify for a free consultation where you and I can go over your medical history and see if this is appropriate, answer all your questions, because we don't want to holler out all our personal questions right out in front of everybody, and we'll get you all set up, and then we'll figure out how we go from there on the labs. Since you are listening, we have another special for you. So you get the discounted consultation, or waived, $150 it usually is, and then we reduce the blood studies for you. They're usually $195, and we can reduce it down to $125 if you've sat through this entire video and listened to Carolyn. So if you'd like to give the office a call whenever it's convenient for you, I know these are weird times and maybe now is not the time, but just remember, that there's hope. We can get you feeling better, looking and feeling as good as you should. So I don't see any major questions there from you, but you could always email me. My personal email is Carolyn, Carolyn, at LowTE Florida.com, and I'd be happy to chat with you. So thank you for watching. I appreciate it. Stay safe. Keep your distance. Be good. We got to get through this thing, but we'll get through it together. So if we can help you in any way, please give us a call at the office. Thank you.